Hi, I'm Kristen, and I've had my ostomy for 15 years. Ostomy surgery can be life-changing. Over time, with the proper system and support from medical professionals, family, and friends, life is not only livable, but enjoyable. Since my surgery, I've dated, attended college, gotten married, and had a baby. I would not enjoy the quality of life that I have today without ostomy surgery.
Hello, I'm here to help you learn about using the ConvaTec SureFit Natura ostomy system with ConvaTec moldable technology skin barriers. This system is very easy to use. The ConvaTec SureFit Natura system offers the security and personal comfort you'll want from an ostomy system. After some practice, you'll make ostomy management just another part of your daily routine. You'll be able to engage in most routine activities, just as before. Ostomy systems use special adhesives or skin barriers to attach pouches to your body. The SureFit Natura ostomy system is a two-piece system in which the skin barrier, which is sometimes referred to as a wafer, and pouch are attached with a plastic ring called a flange. Over the next few minutes, we'll carefully review easy-to-master steps to help you apply and remove your ostomy system. First, you'll see on screen all the products and supplies needed for application and removal. Next, Kristen will demonstrate the best way to apply and remove your ostomy system. Before handling your ostomy system, always wash your hands with soap and water. To follow our demonstration, you'll need to assemble the following items. Please take a moment to do that now. You'll need a ConvaTec moldable technology skin barrier, a stoma measuring guide, your pouch, a ConvaTec tail closure if your pouch is a drainable one that does not have a clipless tail closure system, 2 clean washcloths, all care remover wipes, all care barrier wipes, and a mild soap. ConvaTec moldable skin barriers feature a special pliable adhesive that can be rolled back to create a custom opening tailored to the size and shape of each individual stoma. ConvaTec moldable technology skin barriers have several components that we would like to review. Please take out your skin barrier to follow along. First is the flexible collar. The collar provides an added level of security and flexibility. Second is the plastic ring called the flange. The flange is used to attach the barrier to the pouch. The flange of the skin barrier should match the size of the flange on the pouch. Finally, the circular opening in the center of the barrier is the starter hole. This is where you will begin the molding process. Now, turn the barrier over. There is a clear cover backing over the adhesive center of the barrier with a blue tab for easy removal. You can also see a white release paper on the flexible collar. Both backings should remain on until advised to remove during the application process. If you are using a drainable pouch with the InvisiClose tail closure, you won't need a tail clip. Now, carefully remove the system you're wearing. To remove the old adhesive, clean the surrounding skin with an all-care adhesive remover wipe. Lift a corner of the skin barrier or tape. Wipe the adhesive remover wipe between the skin and the adhesive. Gently peel the adhesive back while continuing to wipe. Then wash the skin thoroughly with a mild oil-free soap. Pat dry. Remember that the skin barrier will not stick if you use any oily substance on your skin, for example lotion or bath gel. For extra protection against skin irritation, you may use an all-care protective barrier wipe. Simply pat an all-care wipe to the area, let it dry thoroughly, then apply your ostomy system. Next, take the stoma measuring guide and place it over your stoma. Measure the widest part, like this. Select the appropriate skin barrier size. If your stoma measures 1/2 inch to 7/8 of an inch, select a 45 millimeter small ConvaTec Moldable Technology skin barrier. If your stoma measures 7/8 of an inch to 1 1/4 inches, select a 45 millimeter medium ConvaTec Moldable Technology skin barrier. If your stoma measures 1 1/4 inch to 1 3/4 inches, select a 57 millimeter large ConvaTec Moldable Technology skin barrier. If your stoma measures 1 1/4 inch to 1 3/4 inches by 1 3/4 inch to 2 1/8 inch, select a 70 millimeter extra large ConvaTec Moldable Technology skin barrier. It is important that after measuring your stoma and selecting the appropriate size skin barrier, you select a pouch of the same size flange. For example, if you're using a 45 millimeter medium skin barrier, you should select a 45 millimeter pouch. ConvaTec has a color-coded system on their product boxes to assist you in gathering matching supplies. If you have recently had your surgery, it is important to repeat these measurements with each system change. That's because your stoma will continue to shrink in size for at least 6 to 8 weeks after surgery. Remove the skin barrier from its package, but do not remove the clear backing of the adhesive or the white release paper from the back of the flexible fabric collar. Then place your thumbs at the center of the starter hole and begin to roll the adhesive back. Periodically, hold the skin barrier so you can view your stoma through the clear release liner window. Continue to roll the adhesive back until you create an opening of the desired stoma size and shape. Please note that it is important to roll the adhesive back and not stretch it back. Remember, this is a moldable product. Do not use scissors to cut any part of the skin barrier. After molding the stoma opening, remove the clear backing from the skin barrier and immediately apply the skin barrier onto the skin. Center the opening over the stoma and press the skin barrier into place on the skin. Gently push the rolled adhesive back towards the stoma until you create a nice, snug fit between the skin barrier and the base of the stoma. This next part is very important. Once you've achieved the desired fit, press the rolled adhesive down on itself. Do this around the entire stoma to secure the fit. Then, hold the skin barrier in place for at least 30 seconds to secure it to the skin. Once the barrier is secure to the skin, remove the white release paper from the flexible fabric collar and press the fabric collar against the skin, smoothing out any wrinkles. If your stoma does not stick out at least a 1/2 inch from your body, you may need to use the ConvaTec Moldable Convex Skin Barrier. In time, the skin barrier will slowly swell around the stoma in what you might call a turtleneck effect. This is completely normal and will not block stool or urine flow in any way. Now we come to the final step, applying the SureFit Natura pouch flange to the skin barrier flange. Be sure you have selected the proper size pouch to fit the flange on the skin barrier. The flange sizes must be the same. Before attaching the pouch to the skin barrier, allow a small amount of air to enter the pouch by gently separating it. Align the flange on the pouch with the flange on the skin barrier at the 6 o'clock position. Using gentle pressure, continue moving your fingers around to the 12 o'clock position. You will hear a series of clicks. As you get to know the SureFit Natura ostomy system, you'll appreciate this unique safety feature. When you hear the audible clicks, you know it's locked into place. Give a gentle downward tug on the pouch to make sure it's locked into place. If you're using a drainable pouch, apply the ConvaTec tail closure by simply folding the end of the pouch over once, slide the tail closure over the fold, and snap it closed. If the pouch has an InvisiClose tail closure system, fold the tail end up towards you 4 times and ensure the interlocking closures overlap. Press the interlocking closures together until you feel them lock or click into place along their entire length. Wrap the security flap around to the back of the pouch and press the interlocking closures together until you feel them lock or click into place. SureFit Natura urostomy pouches feature the AccuSeal tap, which securely closes the pouch while you're wearing it and allows easy draining. Twist the swivel valve so that the red dot faces away from your body. This indicates the tap is open, as you can see here. The tap can also be attached to a nighttime drainage system if you wish. To remove the SureFit Natura pouch from the flange, simply pull outward on the pouch tab and lift it off. Here are some additional application and removal tips. Flat moldable skin barriers have a flexible fabric collar to provide flexibility and gentle adhesion on sensitive skin. The edges of the collar may roll up when exposed to water. Pat the top side of the collar dry, smooth out any wrinkles, and press it back into place. Take care to keep the collar free of any solvents, oils, or creams. Remember to empty your pouch when it is 1/3 full. Never use soap or even mild cleansing agents inside the pouch. You can rinse it out, however, using lukewarm water. To remove the skin barrier, lift a corner of the collar, wipe an adhesive remover wipe between the skin and the adhesive. Gently peel the adhesive back while continuing to wipe until the barrier fully separates from the skin. Never rip or tear the skin barrier off your skin. If you use a closed-end pouch, you may remove and discard the pouch. You may want to put it in a plastic bag with a zip closure when you throw it away. If you use the SureFit Natura drainable pouch with air filter or a closed-end pouch with a filter, you must cover the filter during bathing, showering, swimming, or other water activities. Convenient filter covers are included in each box. If you need more assistance or have questions about using these products, please contact your healthcare professional or call the ConvaTec Customer Interaction Center at 1-800-422-8811. It's going to take a little practice before application and removal of your ostomy system becomes routine. Until then, just remember to prepare everything you'll need in advance and take your time. If you're experiencing difficulties or have any concerns at all, consult your healthcare professional or doctor immediately. And take advantage of the many fine support resources listed in the resource guide. I hope this introduction to the SureFit Natura ostomy system with ConvaTec moldable technology skin barriers has been helpful and educational. Thank you for watching. The following is a listing of electronic bulletin boards called news groups, available on the internet. These news groups provide online, peer-to-peer support to ostomy patients and their families. For information on news group access, please contact your internet service provider. ConvaTec does not support or endorse the advice or content contained in any news group or website. These news groups are listed for informational purposes only.